Welcome to OSHA, a guide to the healthcare precautions for nurses by Stacey, Parker, Instructional Technology Designer. The purpose of this educational activity is to give the nurse a working knowledge, occupational safety and health administration standards, otherwise known as OSHA, and to educate and reinforce knowledge regarding bloodborne pathogen and sharps safety, as well as other important OSHA standards relative to healthcare workers. When must this course be taken? Either at the beginning of each year before the yearly review is conducted by the active working nurses supervisor, or by newly hired nurses who must complete their OSHA test before their first day of work. This will ensure that the nurse is knowledgeable of any new OSHA standards and are aware of their rights and how to protect themselves according to OSHA regulations. Requirements for completing this course. As a nurse, you must understand the rules and regulations of OSHA within a medical setting. Upon completion of this course, you will be taking a final exam at the end, in which you must pass with 100% in order to remain active within your work duties. If you do not pass with 100%, then you will not be able to work with patients or remain active in the medical unit until you can demonstrate a passing grade on the OSHA test. Your supervisor will contact you to discuss your results during your yearly review meeting. What you will learn in this course. Upon completion of the lesson, participants will be able to recognize the importance of following OSHA regulations for safety precautions in the workplace, tell the history of OSHA and the OSHA Act, identify OSHA regulations regarding bloodborne pathogens and other potentially infectious materials, identify bloodborne disease of concern to healthcare providers in the United States, identify regulations regarding sharp safety and handling. Demonstrate the appropriate way of recapping a needle using the one-handed needle recapping method. Perform the correct steps in placing on personal protective equipment and maintaining them after they are soiled. Be ready to protect themselves, other staff members, and their patients using the OSHA safety regulations. Describe employer and employee actions to be taken in case of a bloodborne pathogen exposure. Identify warning labels used in case of known or suspected bloodborne pathogens risks. Describe the chain of infection as it applies to bloodborne diseases. There are a variety of different types of learning activities that are built throughout the course. These activities are structured to help you in learning the material as you work through each section. Each course section will have a short quiz that you must complete about the particular information. You will receive feedback at the end of the quiz. There will be a comprehensive exam that you must take at the end of the course, in which you must receive 100%. Other learning activities that you will encounter in this module are video clips, pop-up definitions and details to highlight what terms are important, additional resources, crossword puzzles, drag and drop answers in sequential order, flashcards, and graphs. So let's begin our journey into learning about OSHA with this module.